Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Today in Neighborhood Health Watch, Level 2 Trauma Center, specifically Henrico Doctors Hospital. A trauma center is a specialized hospital that treats patients suffering from major physical trauma, like life-threatening injuries that include falls, car collisions, and gunshot wounds. These casualty centers vary in terms of the care they provide their patients. Dr. Ralph Layman, Chief of Surgery at Henrico Doctors Hospital, is joining us today at 4. We appreciate you joining us. Let's start out first, if you could, explain the importance of having this type center in our communities, especially now when we see so much bloodshed, violence, mass shootings in communities here and abroad. Why is it important to have access to that type care?
Thank you for having me today. Definitely a trauma center is an asset to a community. At our new center at Henrico Doctors Hospital, we are a trauma center that is part of a trauma system, and that trauma system encompasses the city and the region. In this type of situation, we are one of the key parts to a much broader system. And that's what I'm excited about today. We are here to help the citizens of Richmond and the region, to help them be treated for and recover from any kind of traumatic injury.
Are trauma center doctors better trained, more skilled, or talk about that in terms of what a patient receives when they are treated at such a facility?
At a trauma center, the doctors are all trained in advanced trauma life support. We are surgeons by trade, and we manage the patient from the time they come into the door to the time they leave the hospital. As the trauma surgeon, we facilitate any other specialty surgeons that that patient may need.
How did Henrico Doctors get that designation? What's the criteria?
It took about 18 months worth of work, bringing in new staff, bringing in new surgeons and new systems in order to meet the state criteria for delivering trauma care to the patients of this region. We built a lot of new structures inside the hospital, re-outfitted the operating room and the intensive care unit.
All right, Dr. Ralph Layman, thank you so much for sharing the information. We appreciate it.
Thank you.